This is Marvin White talking about what he wants the world to know about war and his experience in war.
Okay, I think that one of the most important things to realize is for returning soldiers after war. I think it's very important to understand the effects on the soldier, and understand for family members to understand that when soldiers come back, they are the same person, but they're not the same person as they was when they initially went over there. So I think it's very important for you to be patient, to be understanding, and to listen to exactly what these soldiers' problems were while they were there, some of the issues that they were having over there, and trying to cope back into regular mainstream life after serving time in any overseas conflict. So be mindful. I think the biggest thing is just understanding of the soldier and of the issues that we may come home with, to include being patient with him, understanding. And one thing that we do need more of is the family support. We need time with family. The hoopla is not so much of the hoopla. We just need private time. We need family time. We need understanding. We need, believe it or not, we need a mentorship once we come back to get back into dealing with mainstream life. We just need patience and time. I think that's it.
Who do you think should do the mentorship?
Oh, I think the mentorship should come from doctors, primarily probably outside the military, because military doctors will already have, I think they'll be a little bit more biased. We need someone who's on level playing field, who won't be biased towards what we're saying. There'll be more understanding, and it would just be them evaluating us rather than judging us. And I think that's a big issue on the military doctors. They have a precondition as to what we should do, what they expect us to do, but not knowing what we're going to do or what we're capable of doing. So you need a doctor who's on a level playing field, who's actually doing evaluation of what a normal person would be who has not been to war, and a person who has been to war, and do a compatibility or a study on that, and seeing if we have gotten back to normalcy on just other concepts instead of just trying to evaluate us on other soldiers. Okay, I think also the military needs to look a little more into detail on the suicide rate and the potential suicides. Some of the soldiers are coming back, and if they have not demonstrated any ill effects from the war, they are still coming back, and if the family members aspect, there are higher suicide rates. So I just think the military needs to look into a little more deeper. That's why I think the objective opinion of an outside psychologist or psychiatrist will be better than having a military psychiatrist, just to get all aspects of the soldiers and what their frame of mind is once they do return home from the war.